Hello, my name is Dr. Tolulope Alugo from St. John Cap, where I empower youth mental health through education of the youth themselves, their parents, and other caregivers. So, through the month of March, we will be discussing teen depression. And I just thought I'll do this brief video to talk about depression, what it is, common symptoms, the risk factors, and some of the treatment options that are available. So, what is depression? Depression is a condition where there is persistently low mood or feelings of sadness that's present almost all day, almost every day for more than 2 weeks at a time. In teenagers, it may not express itself as sadness, but there may be a change in their functioning where they're just not in their usual mood or state of mind for weeks on end. How common is depression in teens? It's thought that between 5 to 8% of teenagers at any point in time would have experienced a depressive episode. A study in the US showed that about 4.4% of the teenage population had experienced depression in a time period of about a year or so. And this can be up to 8% depending on what population you're looking at. What kind of symptoms would a child show that would make us wonder if they have depression? So one may be feeling sad, low in mood all day, every day for weeks on end. Changes in their sleep where they're either not sleeping enough or they're sleeping too much. They may have difficulty falling asleep or wake up too early, or wake up intermittently through the night, which is called middle insomnia. There may be reduction in their appetite or an increase in their appetite, a change in interest in pleasurable activities. So the things that they previously enjoyed, they may lose interest in. They may become more socially withdrawn from their friends, even from family. They won't want to go to social functions with their parents or their siblings. May want to be in their rooms all the time, keeping to themselves. You may notice that they're unable to focus or stay on task. Their grades may begin to slide from where they previously did well. So always compared to their baseline functioning. They may also begin to express thoughts of suicide or wish that they were dead. They may feel that they are worthless, express low self-esteem, may feel that they feel hopeless. And some of these things may just start small and then continue to progress. What are the risk factors for depression? They are multifactorial. One is that there may be a genetic risk. So whether there's a family member with a history of depression or mood disorder or any other mental health disorder, the risk increases. Environmental factors such as early childhood trauma, exposure to traumatic experiences like domestic violence, war, migration, bullying, any chronic, persistent or relenting stress can increase a teen's vulnerability to depression. We also know that there are changes in brain chemicals that also contribute to depressive symptoms. Other factors may be health conditions like chronic pain, arthritis, having a chronic health condition like diabetes, for example, and the challenges that come with that. Also, we know that sometimes just learned behavior, for example, changes in their behavioral patterns, substance abuse, chronic withdrawal, the pandemic where there was isolation, for example, is been found to be a big risk factor for depression. What's the implication of a teen being depressed? We know that in children and teens, the brain is developing every day. So a teen who is depressed may find that they lose ground in terms of their academic ability because they're not focusing or staying on task. They may choose to withdraw from school, for example. They may miss months or weeks of school, miss an entire term sometimes, or even if they're in school, they're not able to really stay on task, and therefore they're failing. Relationships may fall away. So you can imagine a teenager who spends an entire term or semester just in their bedroom, withdrawn from friends. Those friends move on, and then when they come out of that depressive episode, they may find that they no longer fit in with their peer group. They may miss out on pleasurable family activities, vacations, landmark events within the family. So it has implications for their academic functioning, for their social functioning, and functioning within the family or within the society. In untreated depression, where things become really severe, there is that risk of suicide, the risk of then turning to substances to self-medicate. So we see that teen depression is very important. It's important to recognize it and to get help. So in terms of what help is available, first and foremost, it's important for parents and caregivers to educate themselves about depression, the symptoms, and be able to provide an avenue for their teen to speak to them. So communication with your teen, educating yourself is important, educating the teen. Usually we start with talking therapy. The recommended treatments are cognitive behavioral therapy that looks at the connection between our thinking, our behavior, and our emotions. There's also interpersonal therapy that looks at relationships and how they impact on our mental health. And then there is also medication. When talking therapy on its own isn't working, or where the symptoms are moderately to severely impairing, particularly when thoughts of suicide begin to be a problem. Medications can include the serotonin reuptake inhibitors. Remember where I spoke about brain chemicals sometimes not functioning the way they should? One important chemical in depression is serotonin, and also norepinephrine. So a lot of the medications will work on these brain chemicals. So it is important to seek help early. There's help available. There are lots of therapists who are trained. Go to your family physician, reach out to your child's pediatrician, your family doctor or nurse practitioner early to get an assessment for your child. They may recommend talking therapy in the first instance, or may refer to a specialist. So in conclusion, remember, depression is feeling low in mood all day, every day for weeks on end, or a change from the child's prior functioning. It may present as changes in their sleep pattern, their appetite, social interactions, thoughts about themselves, the future, and people around them. It may affect their functioning in family, in academics, and in the larger society. It's multifactorial in its causes, including genetic factors and environmental factors. There are treatments available, which include talking therapy, medication, making lifestyle changes. I forgot to mention the lifestyle changes. So just having a routine to their day, getting them up at a particular time of the day, encouraging exercise, encouraging a good sleep routine, encouraging a healthy diet, encouraging them to spend time with family and out of their bedrooms, having a structured routine, or what we call activity scheduling. Those things are actually first line in treating depression and should have been mentioned first. So continue to follow us as we continue to discuss teen depression. We'll be discussing cognitive behavioral therapy in the next couple of days. And it's important to reach out if you think your child or yourself needs help in this area. Thank you.